Avastin is a prescription medicine used to treat the symptoms of a certain type of brain tumor and certain types of cancers of the kidney, lung, colon, rectum, cervix, ovary, or fallopian tube. Avastin may be used alone or with other medications. Avastin belongs to a class of drugs called antineoplastics, monoclonal antibody, antineoplastics VEGF inhibitor. Indications. Avastin is used to treat the following eye problems: with age-related macular degeneration, swelling of the retina called macular edema, diabetic retinopathy, retinal vein occlusion. How is Avastin given? Avastin is given as an infusion into a vein. A healthcare provider will give you this injection. Tell your caregivers if you felt dizzy, nauseated, lightheaded, sweaty, or have a headache, shortness of breath, or chest pain during the injection. Avastin is usually given once every 2 or 3 weeks. You will need frequent medical tests. Avastin can cause problems with wound healing, which could result in bleeding or infection. If you need to have any type of surgery, you will need to stop receiving at least 28 days ahead of time. Do not start using Avastin for at least 28 days after surgery or until your surgical incision heals. Before taking this medicine, you may not be able to use Avastin if you are allergic to bevacizumab, or if you have slow healing of a skin wound or surgical incision. If you have had surgery within the past 4 weeks, 28 days. If you have recently been coughing up blood. If you plan to have surgery within the next 4 weeks, 28 days. Tell a doctor if you have ever had heart disease, high blood pressure, a heart attack, stroke or blood clots, a bleeding or blood clotting disorder, or stomach or intestinal bleeding, or perforation a whole artery in esophagitis, stomach or intestines. Warnings. Avastin can make it easier for you to bleed. Seek emergency medical attention if you have any bleeding that will not stop. You may also have bleeding on the inside of your body. Call your doctor if you have signs of bleeding in your digestive tract, feeling very weak or dizzy, severe stomach pain, black or bloody stools, coughing up blood or vomit that looks like coffee grounds, or signs of bleeding in the brain, sudden numbness or weakness, slurred speech, severe headache, problems with vision or balance. Avastin can also cause problems with wound healing, which could result in bleeding or infection. Don't use Avastin within 28 days before or after a planned surgery. Side effects. Every treatment can have side effects. It is important to understand the benefits and risks of any treatment you might have. Common side effects include eye redness, feeling like something is in your eye, dry or itchy eyes, eye discomfort, temporarily blurry vision, floaters. Any eye injection including Avastin may cause these problems, which are very rare. Being extra sensitive to light, eye pain, swelling inside your eye infection, detached retina, where the retina lifts up from the back of the eye, cataracts, clouding of the eye's normally clear lens. Call your ophthalmologist right away if you have any of these problems within a few days of Avastin treatment.